For individuals managing diabetes, Insulin Glargine can be a game changer. This comprehensive guide will decode the ins and outs of Insulin Glargine and how it plays a crucial role in diabetes management. Insulin Glargine is a long-acting insulin that helps regulate blood sugar levels throughout the day and night. Unlike short-acting insulins, it provides a steady release of insulin, mimicking the body's natural insulin production. This makes it an essential tool for individuals with type 1 or type 2 diabetes who require insulin therapy. In this video, we will explore the benefits, dosage, and potential side effects of Insulin Glargine, as well as tips for injecting and storing it properly. We will also delve into common concerns and misconceptions surrounding Insulin Glargine, answering questions such as how it differs from other insulins and whether it can cause hypoglycemia. Whether you're new to Insulin Glargine or seeking further understanding, this comprehensive guide will empower you to make informed decisions about your diabetes management. Discover the power of Insulin Glargine and take control of your health today. What is Insulin Glargine? Insulin Glargine is a long-acting insulin that is used to manage diabetes. It belongs to the class of insulins known as basal insulins, which provide a steady release of insulin throughout the day and night. Unlike short-acting insulins that are taken before meals, Insulin Glargine is designed to mimic the body's natural insulin production by providing a constant background level of insulin. This helps regulate blood sugar levels and prevent spikes or drops in glucose. Insulin Glargine is available under various brand names such as Lantus, Basaglar, and Toujeo. It is typically prescribed to individuals with type 1 diabetes who do not produce any insulin, or type 2 diabetes who may have insufficient insulin production or insulin resistance. It can be used as part of a comprehensive diabetes management plan that includes diet, exercise, and other medications if necessary. Insulin Glargine is a clear, colorless liquid that is injected subcutaneously, meaning it is injected just below the skin. It is important to follow the prescribed dosage and administration instructions provided by your healthcare provider to ensure its effectiveness in managing your diabetes. How does Insulin Glargine work? Insulin Glargine works by lowering blood sugar levels and helping the body utilize glucose for energy. Unlike short-acting insulins that act quickly and have a shorter duration of action, Insulin Glargine has a slow and steady release. This allows for a consistent level of insulin in the bloodstream, providing a more stable and predictable control of blood sugar levels. Once injected, Insulin Glargine forms small aggregates or clusters under the skin. These aggregates slowly dissolve, releasing insulin into the bloodstream over an extended period of time. This slow release helps maintain a steady basal insulin level, which is essential for managing fasting blood sugar levels and preventing excessive glucose production by the liver. It is important to note that Insulin Glargine is not intended to cover the rise in blood sugar levels after meals. For that purpose, rapid-acting or short-acting insulins may be prescribed in addition to Insulin Glargine to control post-meal spikes in blood sugar. Benefits of using Insulin Glargine for diabetes management. Insulin Glargine offers several benefits for individuals managing diabetes. Steady blood sugar control. Insulin Glargine provides a consistent release of insulin, which helps regulate blood sugar levels throughout the day and night. This steady control can reduce the risk of both hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar episodes. Flexibility and timing. Insulin Glargine can be taken at any time of the day, making it a convenient option for individuals with busy schedules or those who prefer not to have strict mealtime requirements. Its long duration of action allows for flexibility and timing without compromising blood sugar control. Reduced injection frequency. Compared to short-acting insulins, which may need to be injected multiple times a day, Insulin Glargine typically only needs to be injected once daily. This can significantly reduce the number of injections required, making diabetes management more convenient and less intrusive. Improved quality of life. By providing steady blood sugar control and reducing the risk of complications associated with diabetes, Insulin Glargine can help improve the overall quality of life for individuals managing the condition. It allows for better management of symptoms, increased energy levels, and the ability to participate in daily activities without the constant worry of blood sugar fluctuations. Dosage and administration of Insulin Glargine. The dosage and administration of Insulin Glargine may vary depending on individual needs and the recommendation of your healthcare provider. It is important to follow the prescribed instructions for dosage and administration to ensure its effectiveness in managing your diabetes. Insulin Glargine is typically injected subcutaneously just below the skin using a syringe, insulin pen, or insulin pump. The injection site should be rotated to prevent skin irritation or lipodystrophy, which is the thickening or pitting of the skin at the injection site. The recommended starting dose of insulin glargine for individuals with type 1 diabetes is typically based on body weight, with a range of 0.2 to 0.6 units per kilogram. For individuals with type 2 diabetes, the starting dose is often lower, around 10 units once daily, and can be adjusted based on blood sugar levels in response to treatment. It is important to monitor your blood sugar levels regularly and work closely with your healthcare provider to adjust your insulin glargine dosage as needed. This may involve titrating the dose up or down to achieve optimal blood sugar control without the risk of hypoglycemia or hyperglycemia. Common side effects of insulin glargine. While insulin glargine is generally well tolerated like any medication, it may cause side effects in some individuals. Common side effects of insulin glargine include hypoglycemia. Hypoglycemia, or low blood sugar, is a potential side effect of insulin glargine. It can occur if the dose of insulin glargine is too high, or if the timing of meals or physical activity is not coordinated with the insulin dose. Symptoms of hypoglycemia include shakiness, dizziness, sweating, confusion, and hunger. It is important to be aware of the signs and symptoms of hypoglycemia and take appropriate action if it occurs. Injection site reactions. Some individuals may experience injection site reactions, such as redness, swelling, or itching at the injection site. These reactions are usually mild and temporary. Rotating injection sites and proper injection technique can help minimize these reactions. Weight gain. Insulin glargine can sometimes lead to weight gain, particularly if blood sugar levels are not adequately controlled. This weight gain may be due to improved insulin action, which allows for better utilization of glucose by the body. It is important to work with your healthcare provider to manage your weight and maintain a healthy lifestyle while using insulin glargine. Allergic reactions. Although rare, some individuals may experience allergic reactions to insulin glargine. Symptoms of an allergic reaction may include rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any of these symptoms, seek immediate medical attention. It is important to discuss any concerns or potential side effects with your healthcare provider. They can provide guidance on managing side effects and help determine if insulin glargine is the right choice for your diabetes management. Tips for effectively using insulin glargine. To ensure the effectiveness of insulin glargine in managing your diabetes, it is important to follow these tips for proper use. Storage. Insulin glargine should be stored in the refrigerator at a temperature between 36 degrees F and 46 degrees, 2 degrees C and 8 degrees C. Avoid freezing the insulin, as it can affect its effectiveness. Once opened, insulin glargine can be kept at room temperature, below 86 degrees or 30 degrees C, for up to 28 days. Discard any unused insulin after this period. Injection technique. Follow proper injection technique to ensure accurate dosing and minimize injection site reactions. Clean the injection site with an alcohol swab and allow it to dry before injecting insulin glargine. Use a new needle for each injection to prevent contamination. Rotation of injection sites. Rotate injection sites to prevent skin irritation or lipodystrophy. The recommended areas for injection include the abdomen, thighs, and upper arms. Avoid injecting into areas that are scarred, tender, or have any skin abnormalities. Timing of injections. It is important to take insulin glargine at the same time each day to maintain a consistent level of insulin in the bloodstream. Choose a time that is convenient for you and stick to it. If you miss a dose, take it as soon as you remember, unless it is close to the time for your next dose. Do not take a double dose to make up for a missed one. Monitoring blood sugar levels. Regularly monitor your blood sugar levels to ensure they are within the target range. This will help you and your healthcare provider determine if any adjustments to your insulin glargine dosage are necessary. By following these tips, you can maximize the effectiveness of insulin glargine and ensure optimal blood sugar control for your diabetes management. How to monitor and adjust your insulin glargine dosage. Monitoring and adjusting your insulin glargine dosage is an important aspect of diabetes management. Regular blood sugar monitoring and working closely with your healthcare provider can help ensure optimal blood sugar control and prevent complications. Blood sugar monitoring. Regularly monitor your blood sugar levels using a blood glucose meter. This will provide valuable information about your blood sugar patterns and help guide insulin dosage adjustments. Your healthcare provider may recommend different testing frequencies, such as before meals, after meals, at bedtime, or at specific times throughout the day. Record keeping. Keep a record of your blood sugar readings, insulin doses, meals, and any other relevant information. This will help you and your healthcare provider identify trends and make informed decisions about insulin dosage adjustments. There are various apps and digital tools available that can assist in keeping track of your diabetes management. Working with your healthcare provider. Regularly communicate with your healthcare provider about your blood sugar readings and any concerns or questions you may have. They can help interpret your blood sugar data, make dosage adjustments as needed, and provide guidance on managing your diabetes effectively. Adjusting your insulin glargine dosage. Insulin glargine dosage adjustments should be done under the guidance of your healthcare provider. They may recommend increasing or decreasing your insulin glargine dose based on your blood sugar readings and individual needs. It is important to follow their instructions and not make dosage adjustments on your own. Remember, diabetes management is a personalized journey, and finding the right insulin glargine dosage may take some time and adjustments. Working closely with your healthcare provider and staying proactive in monitoring and managing your blood sugar levels will help you achieve optimal diabetes control. Comparing insulin glargine with other types of insulin. Insulin glargine is just one of several types of insulin available for diabetes management. Each type of insulin has its own characteristics and is used for specific purposes. Rapid-acting insulin. Rapid-acting insulins, such as insulin Lispro, Humalog, insulin Aspart, Novolog, and insulin glucosine, Apidra, are taken before meals to cover the rise in blood sugar levels after eating. These insulins act quickly and have a shorter duration of action compared to insulin glargine. They are often used in combination with insulin glargine to provide mealtime coverage. Short-acting insulin. Short-acting insulins, such as regular insulin, Humulin R, Novolin R, are also used to cover the rise in blood sugar levels after meals. They have a slower onset of action and a longer duration of action compared to rapid-acting insulins. Short-acting insulins are typically taken 30 minutes before meals. Intermediate-acting insulin. Intermediate-acting insulins, such as NPH insulin, Humulin N, Novolin N, have a slower onset of action and a longer duration of action compared to short-acting insulins. They are often used in combination with rapid-acting or short-acting insulins to provide basal insulin coverage throughout the day. Premixed insulin. Premixed insulins, such as 70-30 insulin or 75-25 insulin, are a combination of rapid-acting or short-acting insulin and intermediate-acting insulin. They provide a combination of both basal and mealtime insulin coverage and are typically taken before meals. It is important to work with your healthcare provider to determine the right combination and dosage of insulin for your diabetes management. They will consider factors such as your blood sugar control, lifestyle, and individual needs to create a personalized insulin regimen. Frequently asked questions about insulin glargine. Can insulin glargine cause hypoglycemia? Insulin glargine can cause hypoglycemia if the dose is too high or if the timing of meals or physical activity is not coordinated with the insulin dose. It is important to monitor your blood sugar levels regularly and take appropriate action if hypoglycemia occurs. How does insulin glargine differ from other basal insulins? Insulin glargine has a longer duration of action compared to some other basal insulins, such as NPH insulin. It provides a more consistent and predictable release of insulin, allowing for better blood sugar control and reduced risk of hypoglycemia. Can insulin glargine be used during pregnancy? Insulin glargine is generally considered safe for use during pregnancy. However, it is important to consult with your healthcare provider for personalized guidance and monitoring during pregnancy. Can insulin glargine be mixed with other insulins? Insulin glargine should not be mixed with other insulins in the same syringe. Mixing insulins can alter their effectiveness and stability. If you need to take multiple types of insulin, use separate syringes or insulin pens for each. What should I do if I miss a dose of insulin glargine? If you miss a dose of insulin glargine, take it as soon as you remember, unless it is close to the time for your next dose. Do not take a double dose to make up for a missed one. Consult with your healthcare provider for further guidance. Conclusion. Is insulin glargine right for you? Insulin glargine is a valuable tool in diabetes management, providing a steady release of insulin to regulate blood sugar levels throughout the day and night. Its benefits include steady blood sugar control, flexibility in timing, reduced injection frequency, and improved quality of life. Proper dosage and administration, along with regular blood sugar monitoring, are key to achieving optimal blood sugar control with insulin glargine. It is important to work closely with your healthcare provider to determine the right dosage for your individual needs.